It's helping our spine. The spine is the one that gives all of the force, all of the energy in our body to come back to the center. This time, I want you to take your hands on your shoulders. Let's do some shoulder circles because we always use our shoulders. This is what really helps. Like my mother is 84-year-old and I've always asked her to do this because more and more you circle your shoulders, you lubricate them. It becomes like a liquid. Take them the opposite direction because yoga is balance. What you do on the left side, you do on the right. What you do clockwise, you repeat on the anti-clockwise. Awesome. So let your hands drop on the knees. Take a deep breath. So about the Rama, Hanuman, and Sita. So in chair yoga, we have adaptability of yoga. In this, I would like to take you to Virabhadrasana and Devyasana with a Ramayana flavor. So keep your right knee and cross it like that, like 90-degree angle. If not, it's fine. Just keep your right knee bent like 90-degree angle. Take your left leg to the side if you can. Side, wherever is possible. If you bump into your partner, that's even better. Just go here. It activates the whole body. Take a deep breath. and exhale, bringing our chin mudra into Devi Asana. This is a beautiful modification of Devi Asana in adaptive yoga. I hope you liked it. So now let us just go back to our breathing just for a few more minutes, and then we can end our practice. So take a deep breath. If you may want to close your eyes, you can close your eyes. If not, just set your gaze to your heart center. Breathe in and out. Bala buddhi vidya dehu mohi. He is the giver. He is the giver of our fourth sheath, our wisdom. It's always there guiding our mind. Intellect is guiding our mind. What is the result? It's ananda, the contentment. With that said, take again and yummy, yummy breath. Take a deep breath. Take the hands over your head. Activate them. This time, take them together as a flower. It's a lotus flower. And guess who sits on the lotus flower? It is your Sita Mata. Bring her to your heart center. Beautiful. So one last request I have, to stand up just for a second, just for a few seconds. Take a deep breath. This is a very small tree asana, like vrikshasana. We talked about flowers, fruits. Where are they coming from? This is from the tree. Right leg, just put that right next to the left leg. Just like that. Just slight bend. Take a deep breath. See if you are balancing yourself straight. Now grow your branches. Let them grow into your vrikshasana. The flowers grow, the trees, the flowers, all the fragrance. Collect them together. Bring them to your own heart center and offer it to your own Bhagwan that resides in your own heart. Now switch the sides. Left leg, align it with the right leg. Balance is important. As we grow older and older, we need balance. So take them, grow your branches, and bring them together, lotus flowers on your head. Because lotus is Sahasrara Chakra. Bring that to your heart center. Take a deep breath and sit back in your chair. So, close your eyes while I guide you through a half minute of Savasana, because yoga always ends with Savasana. Close your eyes and visualize your feet, visualize your ankles, visualize your knees. Come up to your Muladhara, where you're sitting. Go up to your heart center, Anahata Chakra. Guide yourself, bringing your hands to your heart center. Continue to close your eyes. Rub one hand into the other. Create a frictional field within your own arms. Take them towards your own eyes. Blink, blink, blink. Bring your prayer arms again back to your heart center. Shri Ram, Jai Ram. In your heart, you kept the Devi, you kept her. In your own heart, you offered your devotion to Ram Bhagavan. The light in my heart bows down to light in each one of you for joining me in this practice today. With the deepest gratitude, I bow down to all of the acharyas who have taught me this yoga philosophy. Hari Om. Thank you.
Thank you so
Thank
much.
you, Sujata.
Thank you, Hari Om.
Thank you, everyone.
We want you to be back for sure. I think everybody raise your hand if you think Lalita should come back. There.
Thank you. Thank you.
One quick question. One quick question though, Hariom.
Yeah.
Is that music, background music, is it necessary? Because I thought it was kind of distracting.
Oh, next time I will not play it. I could have reduced the volume of that. But for me, music is very important because it brings me into center. But next time, maybe I can just bring down the music. Yeah.
Okay.
Sure.
Or can we have some slow bhajans? That may be a possibility too. Really slow bhajans of some sort. That kind of
okay.
doesn't distract you, but kind of puts you in the direction where she wants us to focus on. That may be a good possibility too.
I did not understand who else was talking, so sorry.
You need to have your video on if you're talking.
I'm sorry.
I'm sorry.
Yeah, no
This
problem.
is Ravi from from Indiana.
Yes.
Maybe a slow music from the standpoint of bhajans or something like that might be very helpful.
Absolutely.
Very
Sorry about the music distraction, and next time I will definitely reduce it. Thank you. Thank you for that feedback, and hope to see you all soon. Keep practicing because our body is our vehicle in this sadhana. So thank you very much, and Hari Om.
Thank you, Lalita. Hariom. Raviji, thank you for that feedback. And thank you for showing your face. I was literally thinking there's some young parent from Chinya Mission talking about the. I just thought it's one of our Chinya Mission parents, actually. So now I know who it is. And Shivaji is like, Hariom, I know you.
Raviji is always full of energy all the time.
Yes, and we would love to see your face and do it too. So, Vinodji, you have a question?
I just have a comment.
Okay, comment, we'll take it because, yeah, we'll move on to the next one.
I don't know, maybe you people know, in Alabama, just they banned the teaching of yoga in school because it gives the Hinduism. So they just banned it.
I think it is still a rule. My understanding is that it's still in the being debated, but very likely it's going to pass because they say it promotes Hinduism. And actually a couple of
it's already passed, it's banned.
Okay.
Yeah, then,
Dr. Shiva has some answer to that. Let's see what he has.
Yeah, I actually grew up in Alabama, and I started elementary school in 1993 when the law was passed. So they banned meditation, yoga, and hypnosis in Alabama schools. They grouped all three of those together because they didn't understand any of those clearly.
Hypnosis and yoga.
Right, exactly. So it's a clear misunderstanding of the basis of yoga. Now, they reintroduced a law, a Democratic state assemblyman introduced a law to try to reintroduce yoga. So it's been banned for the majority of my life. What the stipulations was that they would not use any of the Hindu names for the yoga poses. They would not chant Om before or after the yoga session was done, and that the yoga teachers or whoever was leading the group was not allowed to demonstrate any sort of Hindu imagery during that. However, the bill has already failed the bill to reintroduce yoga has already failed. Again, this is just a lack of understanding of what yoga is and the power that it has and what it can do to benefit the youth of our country. But just to let you know, this isn't an ongoing debate. This has been going on since 1993 in the state of Alabama, and it will likely continue to go on in that state because they don't understand, and the understanding clearly has not improved since that time.
Yeah, but my point is, Lalita, when she was taking the name of Rama, Sita, Hanuman, that definitely Hinduism. There is nothing to do with yoga. Why you recite Ram, Sita, and Hanuman? And again, also yoga is never done on the chair. Yoga is always done on the ground, on asana. You should remember that. And the other thing, it should never be said yoga. It should be called yoga. Like Rama is not Rama, it's a Ram. Lakshmana is not Lakshmana, it's a Lakshman. So, I mean, we have to make it correct.
Yoga is not correct. Sanskritam says yoga. That is what it is, not yoga, but it's not yoga.
Take 1 second? Yeah. Thank you very much for all of your feedback on this. Really, it's like people like you who can bring back this is called culture appropriation. Yes, Americans have taken, Western community has taken. Yoga does not have to be done on the chair, but for those who are not able to sit on the chair, we still need our body, we still need our mind, our buddhi, our mind, and our pursuit is spiritual path. And Bhagwan can be anybody, anything. But for me, Bhagwan today in the event of Sri Ramanavami that we are all celebrating, it is Rama. So I have taken the theme of Rama. I hope it's all right with you all. That being said, I have started sitting on the chair because we want to provide this to everybody. Sorry if anybody was hurt with this. With that said, thank you very much again.
No, I'm not criticizing. Your presentation was wonderful, beautiful.
Wonderful, yeah.
No presentation is easy. Whatever you did, you talked so long, 15 minutes or 30 minutes. This was very good presentation. But I'm just talking in general. What is the impression of yoga in this America? And we should avoid those type of things. Why hurt their feeling? And yoga should be done the way it should be really done. It should be done on the ground, on asana. I mean, using chair is like a physical therapy exercise. They are good exercise. And those physical therapists, they do. Chiropractitioners, they do. But your teacher should not be doing that.
I'm sorry,
Anyhow,
Guruji,
that's it.
Yeah, we'll come back and we'll have like some discussion sessions. Maybe we can do from maybe next session. I think we want to do interactive sessions. We'll keep for that. And I'll not take down this point and maybe send some questions we can all discuss on. Right now, Dr. Shiva is here and I'm waiting to listen to this young, dynamic doctor who has agreed to come on board to see what he has to say about all people. So let's give him a chance. And Rani, can you please introduce him? I'm dying to hear to him, actually. So please, Rani, go ahead and introduce your handsome son, and then he will take from there.
He's my life. That's all I can say. He's my son. He did his undergraduate in Northwestern, and he did Baylor, and then he did again Northwestern, and then Dallas also he did his residency. So he's a ENT surgeon, and he did also specialization also in children too. So he's he did whatever we wanted him to do. I think that's all I can say.
In between, he did.
In between, he said he did MBA too. So, yeah.
Oh, nice. Wonderful introduction after Sri Ram listening to his dad and going to exile for 14 years. Shiva, did you spend 14 years studying all this?
Exactly. Yes, that's right.
Sometimes it feels that way, actually.
No, just one sentence that you are the son of Ram and Rani. That one sentence speaks a lot.
Well, I tell everyone that I meet that I owe everything that I have, and I am everything that I am is because of my parents. So.
Wow, wonderful. That is so wonderful to hear, especially in this Vanaprastha. I will imagine you're my son for one day.
Happy to be there.
Go ahead then.
So yes, as my mom introduced me, my name is Shiva Dharam. I'm an ENT. I'm based in Houston. That's currently where I live. I work for the University of Texas system, specifically one of the branches of the University of Texas system down in Galveston, as well as here in Houston. And I did an extra year of training to specialize in children, but the majority of my training was treating the ear, nose, and throat issues in an adult. So I'm happy to come on and talk about a few of the things that you may see an ENT for, specifically related to aging. And, I have, the majority of questions that we get, or the majority of reasons that people see an ENT for, an ear, nose, and throat doctor, is for sinus disease, allergies, and sleep problems. That probably fills about 70 to 75% of what an adult ENT would see. Now, sinus disease and allergies don't really change with age. I'm happy to, as I said, after I give my short talk, to answer any questions about that, but I'm not really going to go into that because that doesn't change whether you're, a 20-year-old suffering from chronic sinusitis or 70-year-old suffering from the same issue. So specific to aging, I like to focus on a few things. This is a wide field that we've studied quite a bit, but we're going to talk about hearing issues, voice changes, and sleep changes. That being said, as a specialist, we typically are not the first people that have been that you have seen. You've oftentimes seen your primary care doctor, and then you've tried some things, and you've come in to see an ENT. So when you do see an ENT, you're gonna get a lot of very focused treatment options. You're gonna be referred to other specialists. You may even have surgery recommended to you, or other medications. And I do want to let everyone know that early on in the pandemic, there was difficult to see an ENT. That's because we work in the nose and the mouth, which are the highest repositories for COVID, for the virus. It wasn't dangerous for patients to come in to see an ENT. Actually, it was dangerous for us to see patients on a daily basis. But at this point, we're all vaccinated. Almost every ENT is vaccinated. We were on the kind of the front line of the vaccination. And we have the techniques that we need to do to make everything safe for both patients and the doctors. So I do want to, if you have any concerns, or if you had an ENT and you couldn't see them early, a year ago, right when the pandemic was starting, that was the reason, but it shouldn't be an issue anymore. Okay, so the first thing we're going to talk about is hearing loss. This is very common. It occurs. It'll occur in every human being as you get older. The hearing loss will happen at some point in your life. And the reason that happens is because there are a lot of moving parts to hearing. So just to take a step back to understand how someone hears, sound is a wave. It's a wave of air, all right, that does this essentially when you represent it on a drawing. And this wave of air comes through your ear canal. It hits your eardrum, which vibrates, so that's another form of motion. There's ear bones behind that eardrum. That's a second form of motion. And finally, this vibration is transmitted to the organ of hearing, where there are tiny hairs, microscopic hairs that move back and forth. Whenever there's motion in the body, there can be wearing down. And essentially, what causes the majority of hearing loss as you get older is the wearing down of these movable parts of your ear. As you know, as you get older, everything that moves starts to become stiffer. It starts to become harder to move. It doesn't move as well. It's not as flexible. And the same thing applies to even these small microscopic hairs in your ear. Now, there are several things that we can do to help address hearing loss, but the primary thing that you have to understand is diagnosis is key. You have to be able to diagnose the hearing loss before an ENT can help you. So not everyone necessarily needs to have a hearing screen. Some people have ears that are amazing into their 90s and past 100. If they live long enough, eventually these parts would break down, but that doesn't happen to everyone. Whereas some people starting as early as their 40s and 50s can start to see a change in their hearing that's affecting their life. So there are some screening questions, some questions you should ask yourself or ask a family member before you decide whether you need to see someone about your hearing. One of those things is, are you shy when you meet new people because you struggle to hear? So are you starting to isolate yourself and you don't want to be a part of social events because the fear of meeting someone new and not understanding what they have to say embarrasses you? Another question you can ask is, do you get frustrated when you are around your family, specifically because you cannot hear them? This, one of the subtle points to this is younger family members you may be more frustrated with than older family members. The reason for that is young people, especially children, have very high-pitched voices. And the part of your hearing that you lose earliest when it's due to age-related changes is the high pitches, the high frequencies. The little kids who talk like this. That's what becomes more difficult to hear first. And so as you get older, you may struggle to hear your grandkids, but have no problem understanding your friends and your children. So that's just something to keep in mind. If you're still working, are you having trouble hearing your colleagues or your clients or interacting with people on the phone due to with work-related issues because of your hearing? Do you ever feel restricted or isolated, feel like you're left out because you're not hearing well? One of the big things, one of the first parts of hearing that goes is the ability to hear in a noisy environment. So you may have no problems hearing your family or your loved one when you're in a quiet room. But if you're in a social gathering with your extended family or your friends, if you're at a dinner, when we start going back to in-person dining, when you're in a loud dinner environment, when you're in a movie theater, you know, it's hard to hear in a movie theater, but usually you can communicate with the person next to you. But if that becomes difficult, this is something that should tip you off. Hey, maybe my hearing is starting to worsen. I should see someone. A big one is family concern. We tell our parents, as I said, I do see a lot of children for hearing issues, which is a whole nother discussion. But the biggest, the best actually screening tool for do you have hearing loss is, do the people around you tell you that you have hearing loss? So for kids, it's parents, if the parent is concerned, but for adults, it is your loved one. It's the person that's with you all the time. If they are concerned that you have hearing loss, then that is a huge reason to get evaluated for it. And finally, one of the biggest things is the TV, because that is such a ubiquitous part of our life. That's a great screening tool. If you have to raise the volume of the TV much louder than the people around you have to, or it's uncomfortable for the people around you, the volume that you have to have the TV, and you've heard that multiple times, then again, that is an indicator that hearing loss may be affecting your life. So if you said yes to one or more of these questions, I strongly advise you to talk to your doctor at your next checkup about getting your hearing tested. The first specialist you should see is actually an audiologist. An audiologist is a hearing test doctor. They're specifically designed to perform hearing tests on all ages. And then they also deal with hearing aids, which we'll talk about at the end of this little blurb. But the audiologist will do a formal hearing test. It's called an audiogram. Once you have that, that will let the audiologist know and your primary care doctor know if hearing loss is actually the cause of the problems that we talked about earlier. And if hearing loss is diagnosed, then you should go and see an ENT to discuss the issue. Now, some of them can be fixed immediately. If you have a lot of earwax in your ear, an ENT can clean that out and improve your hearing right then. I also tell all of my patients where earwax buildup is a problem and causing hearing loss that you can get over-the-counter ear drops, or you can make your own with hydrogen peroxide and water. You mix them and use them once or twice a week, and that'll help keep your ear clear of earwax. All right. They may diagnose a problem with some of the moving parts of the ear that you hear with, that you can see. So the bones or the eardrum itself. That typically can be fixed by surgery or with a hearing aid. Or they may say it is a problem with the organ of hearing. It has worn down with age because it has spent your whole life hearing. Those little hairs have been moving nonstop. Even when you're asleep, you hear. So they have been moving all day, every day from birth to this point in your life. They have worn down, and that is the cause of your hearing. If that is the case, and that is the most common cause of age-related hearing loss, then the ideal situation is to get a hearing aid. If it is affecting your life, you should strongly consider getting a hearing aid. If it's causing you to be frustrated, if it's causing your loved ones to be frustrated, if you're not able to hear your younger family members who may become a bigger part of your life as you get older, then it's really important to get a hearing aid. There are dozens of types of hearing aids, and their technology is amazing. It's not just a microphone. It's not just someone with a megaphone in your ear making all noises bigger. They are finely tuned, so each frequency is amplified or made louder, just enough for you to hear, but not too loud to be uncomfortable. So hearing aid technology has vastly improved over the last 30 years. Also, hearing aids have become much smaller, and the majority of the parts in front of your ear now can be clear. So they're not able to be seen from the front. Now, from the back, there still has to be a receiver. There's some electrical parts. So these will be seen. Though the men with longer hair, women with long hair, you can hide essentially 95% of the hearing aid. So if there is any stigma to wearing a hearing aid or feeling that you don't want to be seen as aging, or you think that cosmetically it doesn't look nice, we are able to make a nearly hidden hearing aid for you if that's the case. There are surgeries such as cochlear implants, which is something that I did my extra training to perform, which will, if you're completely deaf, we are able to give you hearing again. It's a different type of hearing than God gave you, but it's something so that you can recommunicate with the world. But the majority of patients with hearing problems benefit from a hearing aid. I do have to tell you this. We get this question a lot. So children are the only humans that the government saw the need to definitely cover hearing aids for. All right. So if you are a child with hearing loss, they will cover everything for you from the beginning diagnosis to the end, hearing aids, and all the programming and surgeries if you need it. Okay. Once you hit 18, the government has deemed it a quality of life issue. So private insurance companies have followed suit. So regular Medicare, most private insurance companies do not cover hearing aids. They may not even cover the hearing test. Okay. If you have Medicare Advantage, there are some plans that will cover the hearing test and they will contribute to hearing aids. I don't like talking about that side of medicine, so I'm not going to spend a lot of time on it, but safe to say, if this is a problem that you think you want to address, I would contact your insurance company or have someone contact your insurance company to figure out what they would do. Okay, so that's my spiel about hearing loss. That's the primary thing that ENTs deal with in terms of aging. I see Vinod Uncle has a question, so I'm happy to answer that question, and then I'll briefly touch on sleep issues and voice issues after that.
First, let me congratulate. Very good presentation you have. You answered most of my question. But only thing I'm wondering, hearing aids, why they are so expensive? They go up to $6,000.
Yeah.
But at the same time, I talked to one gentleman. He said he purchased one $10 was working better than the $5,000 one. Believe it or not, they sell it at $10 also.
That's completely correct. So what companies have done is, with the advent of online marketing, the ability, so Amazon is ubiquitous essentially. So now there's online marketplaces. So what you can do is you can essentially buy a non-programmed hearing aid, which essentially acts as just a microphone. Okay, it makes all sounds a little bit louder or some amount louder, all frequencies, and those can be as cheap as less than $100, and they can go up to a few $100s without the programming. What makes a hearing aid expensive is that technology where each frequency is amplified or the sound is increased. The low pitch ones are typically done less, because remember, those wear down less with age, as opposed to the high frequency or the high pitch tones wear down earliest and they wear down the fastest. So those need to be amplified more. Now, there are some people who have a fairly steady hearing loss all the way across from low pitch to high pitch. If that's the type of hearing loss you have, then a non-programmed hearing aid that you can buy online may work great for you. And if that's the case, you can just manually turn up however loud you want it so that you can hear fine without it being uncomfortable. The reason that hearing aids are that expensive, $2,000 to $3,000 per hearing aid, is because, again, the finely tuning and then the cosmetic avenues. You can get a bigger, bulkier, older generation hearing aid that works just as well for cheaper than that. Costco actually used to sell hearing aids. I don't know if it depends on your local Costco as to whether they're doing that, but actually you could get a cheaper hearing aid that they will program for you and fine tune for much cheaper than you would get from a private audiologist. But then these really expensive hearing aids are the ones that are clear in the front and are very difficult to see. They add Bluetooth to these hearing aids, so they connect straight to your phone. So a phone call goes straight into the hearing aid. In your car, radio can go straight to your hearing aid. So there's a lot of features that they add. The more features, of course, the more expensive they are.
Okay. You went
Dr. Shiva, I have a question. Oh, go ahead.
You went to Northwestern University. It's a very good university. Why did you go to Northwestern? You were in Chicago or you were somewhere else?
No,
Sorry, this is not the time for that. No, we can't do that.
No, I couldn't.
Okay,
No,
so
we are
let
all
me ask a
waiting.
question.
We are all waiting on him for jewels of information. Personal time, we'll call him again for a personal tea with us.
Okay, question.
Sorry.
Anil has a question, so we'll take Anil's
So, Dr. Shiva, at a lower level, and by the way, your presentation was excellent. I echo that same sentiment. So, for daily regular maintenance of your ears, what are your recommendations, such as oiling, applying a little oil, or using a Q-tip or not? And I'm talking about common itching and rattling in the ear, and just common everyday maintenance or every month maintenance. What do you recommend?
that's a great question. That's honestly probably one of the most important topics to discuss. I'm really glad you brought it up. As far as maintenance of the ear is often a self-maintaining organ. So what we recommend is minimal need for maintenance unless a problem has been identified. Now, if you're having a buildup of earwax, let's say, then that's an important discussion to have with your primary care doctor and your ENT, if you see an ENT, to help you get rid of that earwax even one time. What I suggest for maintenance of that, if that is a problem that you've noticed, is the first thing to do is eliminate any use of the Q-tips inside the ear. The reason that happens is the first half of your ear canal produces wax because that's where the hair is, and the wax is produced by the cells that maintain and grow the hair. There are whole units that make wax, not sweat. The units on the skin make sweat along with the hair and grow the hair. The units in the ear make wax along with the hair. This is to help keep the ear canal clean, actually. If you use a Q-tip is a pushing instrument. It's not a grabbing or scooping instrument like an ENT would use to remove wax. So if you put a Q-tip in your ear, some of the earwax will stick to it, no doubt. When you pull the Q-tip out, you'll see some wax. But the majority of that wax gets pushed. And if it gets pushed to the second half of the ear canal, the half of the ear canal that's closer to the eardrum, that part of the ear canal is not used to wax. There's no hair there. And so it doesn't produce wax normally, and the body lacks the ability to get that wax out of the ear canal. So all you do is cause a buildup of wax very close to the eardrum. If you need to maintain a ear canal that is clean of earwax, then I recommend using dissolving drugs. Hydrogen peroxide or acidic solution. So vinegar is the one that we use we tell people to use most commonly. Will dissolve the wax and soften it and allow for it to run out. If you go over the counter, you can buy a kit called Debrox. This comes with the eardropper. It comes with dilute hydrogen peroxide or something similar to it. You can use a few drops in the ear. I would say once or twice a week. You'll hear a buzz. You'll hear actually a tingling because it's bubbling. That's what hydrogen peroxide does when it gets exposed to light and air. And so you just sit there for a minute or two with your ear up to allow for it to work, and then right your head, and all of that will rush out. And do the same thing to the other side. Now, ear itching is usually due to ear dryness. It can rarely be due to a fungal infection, but typically you have pain and you have drainage with that. So if it's just ear itching, what I recommend using, the first step is using mineral oil or some sort of oil, baby oil. It will moisten the skin of the ear canal. All right. Creams are obviously what you do for the skin of the outside of your body. It's hard to get creams into your ear, but oil does the trick. All right. And just like we oil a baby's skin to help keep it moist, baby oil in the ear canal will also moisten the skin. And I should take one step back. Your ear canal is coated in skin. Sorry. The ear canal is coated in a similar type of skin that's coating your ear, and it goes all the way back to the eardrum and actually coats the eardrum as well. So it's all just skin actually, inside of your ear. Using oil can help with, and again, once or twice a week. You can use it every day if you wanted to. Usually typically don't have to do that. Oil, unlike other liquids or water, won't encourage bacterial growth of the skin in your ear, so it's safer to use more often than other liquids. But that being said, once or twice a week, allow the oil to sit in your, put a few drops in your ear canal, sit with it with your ear facing up for a minute or two, and that should help. If the itching is still bothersome, then you may need a steroid drop. So just as extremely dry skin can cause itching, and it can even be pathologic, that's what eczema is, and steroids treat that. The same thing can happen to your ear canal skin. It can get very dry as the ability to make the wax goes away with the age, or in some people it gets worse with age. Steroid drops can help reduce the inflammation the dryness is causing and reset the itching there. However, it's very important not to use steroid drops for very long or use them without the direction of a doctor, because steroids decrease the immune system and cause skin breakdown when you use them long term. So using a steroid drop, like I'm saying to use the hydrogen peroxide or the oil, which are both antibacterial, that will not be a good idea because it can lead to infection of the ear canal.
So you mentioned hair several times. What role does hair play in the ear?
So the way the body has created these units is that the units that make sweat or make oil for your face, which is different than the sweat on your arms and legs or back, which is different than the wax that you make in your ear. It all comes as a unit. Genetically, that's just how the human body was designed. So when in order to have the wax producing glands, they are going to be associated with hair follicles. And that's just kind of how the ear is designed. Now, the role of hair probably in the ear is similar likely to the role of hair in your nose. It's probably a part of your filtration system. The body is always trying to prevent things, dirt, large particles, as well as small particles. But hair doesn't really help prevent bacteria. But the hair in your nose, the hair in your ear, probably similar in terms of trying to be just a coarse filtration system to prevent things from getting in there. Or trapping it so that the wax can then trap whatever gets caught in the hair and then force its way out.
So my hairdresser keeps claiming that I have too much hair in my ear. Is that bad? What does that mean?
As you get older, hair grows longer in certain places and shorter in other places. It's typically due to actually hormonal issues, specifically a type of testosterone that you make and an enzyme that converts some testosterone to other types. But some of your hair is sensitive to that, other hair is not, and actually grows more. So as you age, you may lose hair on the top of your head, but you'll gain hair on the sides of your hair, on the sides of your head. Same thing happens in your ear and your nose, actually. It's not a problem unless it's causing hearing loss. Again, but excessive hair doesn't cause hearing loss. The excessive wax can cause hearing loss from a physical blockage of the ear canal. But that's more of a nuisance, I would say, maybe to your hairdresser. But if it's not bothering you, I wouldn't worry about it.
Yeah, hair, if you don't want it, it'll grow, I'm sure. Sharda ji, did you have another question?
Yeah, that was very good presentation, Dr. So I'm from Winnipeg, in Canada, Winnipeg, Manitoba from.
Oh, great.
So this is, I think, second time I have joined. And my husband had recently, he got hearing aid from Costco because there is a hearing for 1 year because of his cancer situation. They had told in the beginning, like, you probably lost your hearing listening. So now he got they gave him both. So one side is, I think, 85%, and 1 ear is 48, what the hearing things. So, but they gave him, he got both hearing just a month ago. He just 1 month ago. So like she suggested, doctor, like they gave him both ear, but she said you can hear with the one, even if you don't have another one, you can still hear for the right. The good ear, she recommended. Bad ear, she said, is up to you. but he just had a trial. So what my sunte hai, you come here. So I'm asking that question you have so so he wearing both, but then you tell me how you feel when you use both.
So if you have any question, this is the time to ask. Your wife
Yeah.
wants you to ask right now.
Yeah, she's thinking maybe I should have only one. And that's what the audiologist also suggested. Price is not the concern. But when I use both, my ear, this side, right ear, was practically, I would say, zero.
Mhm.
But when I put this, it makes tremendous difference.
Yeah.
Tremendous difference. The only thing I don't like, that no matter how much I adjust on computer, I still have to adjust because hue is too much. So I have to adjust, and then I'm fine, no fear.
So this is it's a really subtle issue that you're having in terms of what they're trying to coach you through. When you talk about significant severe hearing loss, which is what you have on one side, there is a point at which hearing aids are very difficult to help, because it doesn't matter how high you turn up the sound. Sometimes you just can't get it high enough for you to hear, because that part of the ear has worn out. That the hair cells that are moving in that frequency, so that pitch, you just can't turn up the volume enough to hear. Another reason is the louder you have to turn up a hearing aid, there's some physics involved with feedback. So you start to get this feedback. It's like that really loud noise when you put a microphone near a speaker. I don't know, when you ever go to if you go to a public event and someone has a microphone and they're talking, and then you hear like a really loud noise, and they have to move the microphone away from the speaker. That is feedback. So as you have to turn the hearing aid power up, and it's got to get louder and louder because your hearing loss is more and more severe, you run into issues with feedback. You just can't get it high enough before feedback starts to become a problem. And so that's what they're trying to suggest to you. They're saying that your hearing is so bad on one side that even this conventional hearing aid technology, we're just not equipped, not able to turn up the volume enough without causing other problems. But that's why we try it, because for some patients, they are able to get that hearing aid volume loud enough, and they're not bothered by the feedback. They are able to hear well with that hearing aid. Now, with the ear where you have less hearing loss, a hearing aid is perfect. They're going to be able to get you up to 100% hearing, like you were hearing when you were a young person, before you had hearing loss, because that level of hearing loss is ideal for a hearing aid. A well-programmed hearing aid will get you where you need to go. But with the side that has less hearing, there is a limit to what a hearing aid can do. And so they're just suggesting to you that sometimes when it gets turned up so much, it actually causes you problems that you didn't have before when you only had one ear. So you just have to see whether you're getting a benefit from it. The benefits to having two binaural hearing, so hearing in both sides, are sound localization. So when a sound comes in, if both your ears are hearing, you can tell where it's coming from. If only one ear is hearing, you'll have trouble with that. Also hearing in noisy environments. So things like, as I talked about, social gatherings, restaurants, movie theaters, things like that. You'll be able to hear better if you're hearing from both of your ears than if you're hearing from one. It's not impossible, but it's better. But you just have to see for yourself, when I have both hearing aids in, am I able to hear better? And is the turning one hearing aid up all the way, as loud as basically they're having to do it, is that allowing you to hear well? Or is it causing you problems? And then just go with the one hearing aid, hear perfectly out of one ear, nothing out of the other ear, and you just have to really concentrate when you're hearing. But you'll still be able to hear perfectly out of that ear.
Yeah, thank you. That's what she was trying to tell me. It becomes so sensitive that I can hear my feet running on the
Right.
path. I'm laughing.
Yeah. It's like a
Yeah.
blowhorn in that ear, basically. You have someone yelling as loud as possible into that ear. That's what a hearing aid turned up to that volume is. And so it's hard to get it comfortable because you got to turn it all the way up. So it's either you can't hear or it's too loud or there's feedback and it's painful and it's noisy. And that's the time you just say, forget it. I'll just hear perfectly out of one ear, and I'll be able to adjust with that.
Yeah. Thank you. Thank you.
That's good to know. But when if I want to contact you in future, I will be asked number from her.
Yes, sure. Rani.
Definitely. Happy to help anyone.
Thank you so much.
Thank you.
Thank you so much.
Raviji has one question. We'll take that and then end the session.
Yes, doctor. I have been using hearing aid for the past 38 years or so. I had multiple surgeries. I had multiple surgeries in my right ear, multiple staphylectomies at least 3 times. Every time it kind of kept going, it failed. And now I tried a Bicross hearing aid. I don't want to, and I got confused with that. So I just decided that I'm going to stick with my good ear with a hearing aid. And that's what I've been using for the past 35 plus years. I got used to it, but I still am kind of wondering, is there anything that I can try to see if because speech understanding is the problem I got, not the sound. They restored the conductive, but speech understanding, because of the fact that I didn't use the ear for long enough time, it's kind of lost its ability to hear, so ability to distinguish the sound. Is there something that can be done, or just I'll have to accept the fact and just live with it?
Unfortunately, with speech understanding, it is more of a neural issue at that point. It is the processing of the sounds in the speech centers and the hearing centers of the brain, and those kind of interacting and meshing together. All parts of the brain are, as you said, you nailed it right on the head. When you're not able to hear a lot, and that message is not being sent on the nerve to the hearing centers of the brain, then that part of the brain starts to atrophy and actually get taken over by other things, right? Yeah. So, when people say, oh, if you lose one sense, your other senses get heightened, it's literally because that part of the brain is being repurposed to heighten the other senses, and the other cognitive functions that your brain has. And once gone, it is very difficult to regrow. Those connections, as intricate, they're extremely intricate. And, that is essentially our proof that there's God. If someone asked me about that, you just ought to have looked at the human brain. It's impossible to even comprehend what that is. Those connections are made early in life, right? And they're only made when the brain is growing and when the brain is forming those things. And then it reaches an area of stability. Again, going back to what we see in kids, if they're born deaf, we have to get them hearing very quickly, or they will never be able to speak, because it's not just about being able to hear. You can restore the signal going to the brain. That part of the brain doesn't know what to do with sound anymore, right? Exactly. Because it just hasn't been used. So the same thing as you said, unfortunately, with speech recognition, specifically that, you're right. We can restore the ability for the sound to get to your brain. You said it. You're very well versed in this, because you're using the words that I would use. They restored the conductive component of your hearing. And that's what hearing aids do. They can restore that portion, the portion of your hearing, in a patient who has otosclerosis and needs a stapedectomy. But they cannot restore that neurologic part, that part where the hearing center is taking those sounds and turning it into something your brain is understanding.
Thank you.
Yeah, thank you so much. Really appreciate. I think this was a very valuable session. We would love for you to come back. Let me book it for the next 1 year, whenever you're free or something. I think it's a really, and I think we haven't, not many people knew about how the session is going to be, because I had no idea what you were going to talk about. We didn't get a chance to actually interact much. I know it was a little bit last minute too. Vinodji, is it pertaining to
it is about hearing. Dr. Shiva, is it true that people have selective hearing? They hear the things they want to hear and they don't hear the things they don't want to hear?
So
Like some people have money. You talk about money, they hear everything. Or if they
What
are
did you
interested in
say?
food, they hear it.
What did you say, Vinodji? Sorry, bye.
No, I mean,
Okay.
We deal with from birth to death. Essentially, you will deal with selective hearing. So I tell all my patients, I call that listening. So I can treat hearing loss, but I cannot treat listening. So if someone decides not to listen to you, I can't help that. But if it's hearing issues, then I can do something about it. But yeah, selective hearing, it's definitely a part of everyone's life. I have 2 kids myself. They definitely selectively hear what I'm trying to say. So
That's true.
Sujata ji, can I ask just one quick question? Okay. I just wanted to know when you will be coming back to talk about the sleep issues.
Oh, yeah.
That is really one of the things. I certainly do feel that as an issue. So I just wanted to, not that I'm, but just wanted to understand what we could do to help ourselves out from the standpoint, dealing with sleep issues.
Yeah, I'm happy to, I'm happy to come back anytime you would like me to discuss sleep issues, and there is I'm happy to discuss sleep issues in general. And if you want to talk offline, my parents have they're happy to give me your phone. I can have a conversation with you or text or however you want to communicate. But I'm happy to talk about. There's a huge variety of sleep issues that occur in all age groups, but especially with as you age, your sleep patterns change, the issues you have with sleep change, and it's just really important to get those details hammered out and see the right person. There's a whole field of sleep medicine that is based around sleep studies that can really help out. And then obstructive or anatomic things, so problems with your anatomy that cause sleep issues, that's where ENTs come into play again, because our field is centered around surgical treatments for a lot of issues. So when that's the part of sleep that I'm most comfortable with, actually most of my surgeries at this point is treating obstructive sleep apnea. But that's I'm happy to really talk in detail about that,
great.
and help you on the right path for anything else.
Figure out and see what schedule works for him, and
Yeah.
see if we'll beg Rani hold her. She's very easy to work with, definitely. So we'll figure that out, and we'll try to coordinate and see if we can bring him again as quick as possible.
Thank you.
Thank you so much. Dr. Shiva, you can see everyone loves you, so you have to be on our panel to come along.
Yeah.
Now we end the session because it's more than like 90 minutes has passed. So do it more time. I'm sorry that you came prepared with more stuff, but don't have that much time. But we would love to have you again, and we'll go from there. Shishmaji, do you want to do the closing prayer, or I can do it? Yes.
Okay, let's close.
Okay, thank you.
All right. I'm going to do the ending prayer and we'll go from there. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramayam, Sarve Bhadrani Pashyantu, Ma Kaschid Dukkha Bhag Bhave. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vashishyate. Om Shanti Shanti Shanti. Hari Om Shri Gurubhyo Namaha. Hari Om. Hari Om, everybody. Thank you for joining. It was a wonderful session, and hope to do more of this. So let everybody know. I think those who didn't come today missed out on a lot.
That means a lot. You are